Chamgei chitab Kalenjin eng mitugul ole imitei boroindo nebo tetutieng'ung nebo tililindo rani. Kainenyu ko Chesankaro nebo Arap Sirma, kimitei ak daktari noto ko Hilary Tarus ne inendet ko ng'amotiot ne konyoindet nebo kaimutik chebo kabwatutik anan psychiatrist. Ko itakat daktari betutab rani eng Kass TV.
Go missing.
You welcome, daktari.
Asante sana.
Let me give you a chance to introduce yourself and then we continue.
Thank you. Thank you very much. So my name is Dr. Hilary Tarus. I am a resident psychiatrist at the Mathare National Teaching and Referral Hospital. I have over 8 years experience as a general doctor. Before choosing the field of psychiatry to venture into the field of mental illness. And also thank you very much for inviting me onto this platform. Thank you very much. You've been very hospitable, both you and Chamtai.
You're welcome.
Yeah.
You're welcome. So what is this, when you say psychiatric, I mean, you have issues with psychiatric issues. What do you really mean?
Okay. So first of all, I'll define who is a psychiatrist, right? What is the work of a psychiatrist? So a psychiatrist is a doctor who has specialized in the field of diagnosing and treating mental illnesses. So once you're a doctor, you have the option of choosing which part of the body do you want to specialize in, because medicine is very broad. There's not enough time to learn of every part of it. For example, a doctor who treats the bones, anaitwa orthopedic surgeon, daktari wa tumbo anaitwa gastroenterologist, daktari wa macho anaitwa ophthalmologist. Now, there's a part of the body that cannot be seen, but it can be heard and it can be felt. And when it's sick, you can tell, and that is your mind. Now, to help someone understand better what the mind is with something you can understand, like for example, you're holding a phone in your, right? So for the phone to work, two things have to be working properly. You have the hardware, the wires and the circuit board and the screen. And then you have the software. The software is something that you cannot see, but if the software is corrupted, your phone cannot work. So your mind is like the software, right? Your mind is that which helps you to choose how you're going to behave, how your emotions are going to be, how you'll perceive things around you. So a psychiatrist is a doctor who has specialized in diagnosing and treating the diseases that affect the mind. Yes. So when we say you have a psychiatric illness or a mental illness, it means that there is a problem, there is an illness that is causing a disruption in how you perceive emotions, how you behave, how you interpret the world around you. Yes.
Now, that is now a psychiatrist.
Yes.
You've made us understand about the psychiatrist.
Yes.
And that is your work. So what is your work actually?
Like I've said, the work of a psychiatrist is to diagnose mental illnesses, to come up with a treatment plan, offer therapy in some cases. Yes, basically to treat mental illnesses. So for example, you could have a patient who is behaving in an unusual way. I'll give you an example. So for example, your brother or your sister is out there picking papers, right? Out there in the streets. You take him to the hospital. Of course, they will do a CT scan to check the brain if there is anything, any brain infection, because there's many illnesses of the brain, like a brain tumor or a brain infection that can cause someone to behave in an unusual way. So after going through all those tests and they don't find anything, that is when you send them to a psychiatrist. Yes, because unfortunately most mental illnesses cannot be diagnosed through a blood test or a brain scan.
So your work must be very interesting. So it's like you can sit and look at me and know that I have a problem somewhere.
Well, observing the patient, yes, is a good way to decide. There's certain behaviors you can tell that someone might have. But also it involves collecting proper history, communicating with the patients, asking certain things like about their sleep cycle, their eating habits, are they perceiving, even talking to their relatives, yes? Because there's some things that you can do you're not aware of, but your husband or your wife can be aware that, oh, I noticed last night he was doing this or he was saying this. Yeah, so it involves not just looking at the patient, but also talking to them and also their family members. And also it will involve also doing other tests to make sure that you rule out other causes that are not psychiatric in nature that could be causing these symptoms. Then after doing that, after coming up with a diagnosis, because there's very many mental illnesses, and we do have a journal, a very thick book called the DSM-5, which helps us to categorize illnesses. The first step of treating any illnesses is to diagnose it, right?
Yes.
That's the most important part. I used to have a lecturer who said, diagnosis is the first step of treatment. Because if you have a diagnosis, you can just go to Google and see what is
That's required, yes.
and just go to the pharmacist. Yes. So the first step is to diagnose what does the patient have, what kind of illness is it? Is it depression? Is it anxiety? Is it schizophrenia? Then from then you can come up with a treatment plan for the patient. So the treatment of mental illness usually involves two things. You have what is called therapy, psychotherapy, basically counseling, right? And then you have medication. Depending on how bad the illness is, you can choose either just to go the way of counseling or to combine both of those two. But unfortunately in Kenya, because we have limited specialists, people who can do counseling and all whatnot, we find ourselves relying more on medication on a lot of illnesses that we can just as well send them for counseling.
So you mean you also treat, like there are injections, there are what? I thought mental is only mental, as in just...
Okay, no. We even have, we even have medications that we give, for patients with mental illnesses, depending on which one. We even have injectables. Tuko na shindano tunadunga watu. Zile shindano ni ya malaria peke yake. Hata mimi nakudunga.
Wow. Now, maybe you tell us the types, as I think you've mentioned, but maybe expound on these types. You've said there is the psychiatric, there are terms you used, I don't know.
Okay.
Yes.
Or what are the types of mental illnesses,
Yes,
if I can categorize them and group them? I want you to understand when we talk about mental illness, we're not just talking about that individual you saw in River Road picking papers. We're not just talking about that. We're talking about something as simple as anxiety disorder. Yeah, just if you have excessive anxiety to the point where you can't sleep, that's also an example of a mild form of mental illness. Now, almost all adults will experience a symptom of a mental illness at one point in their life. They say about 20% of people in the world would experience depression at one point in their lives. Okay, so let me give you the groupings of mental illnesses. So in a broad sense, I can classify mental illnesses as, so we have anxiety disorders. These are things that causes a patient to be excessively worried about things. There's many different types. One of the most common, and I hope, let me say this, maybe someone out there will know what I'm talking about. An example of an anxiety disorder is what we call panic disorder. So you find a patient will have what we call a panic attack. They'll have an episode where out of nowhere the heart will start beating fast, they might start shaking, they might get confused, start sweating, kwa sababu tu ya uoga. That's one example, anxiety disorders. Then we have those that are called mood disorders. That is where you find depression and bipolar. So your mood is just basically the amalgamation of the emotions that you're feeling over a long period of time, right? So usually your mood is affected by things that we can measure, like how was your day? What did you eat today? Who did you speak today? What are you looking forward to? Right? What kind of job do you usually have, right? So if your mood is congruent to the things that you're going through, like for example, if you're at a funeral, you're in a bad mood, that is okay. But when you have a mood disorder, it means that your mood is can go up and down regardless of the factors around you. I'll give you an example. You can find someone in a birthday party. Kila mtu amefurahi lakini tu yako. Unauliza nini?
Nothing to smile about in a party.
Then you have what we call psychotic disorders. With psychotic disorders, we have patients who experience psychosis. Psychosis is when you see, hear, feel, believe, or smell things that are not real. Yes, like ukiona mtu anajiongelesha anaongelesha mtu mwingine, or someone will tell you like, I am, very interesting, I am the son of Raila Odinga and I live in State House, right? They believe something that is
not there.
Or akisema anasikia masauti, yet no one else can hear the voice. So all those disorders that causes psychosis fall under that category. Yes, and then we have what we call neurodevelopmental and neurodegenerative disorders. So these are mental illnesses that arise from either the development of your brain or something happened to your brain, maybe an infection. Because your mind also depends on how well your brain is able to work. So under this you have things like autism, you have ADHD, attention deficit disorder. These diseases would usually affect how a child will develop his or her social skills, how they'll be able to interact with the world around them. And then we have substance use disorder. This is actually the most common form of mental illness in Kenya, where a patient will use a substance. Nikisema substance, I mean like a drug, like an alcohol or whatever, despite the negative effects that it will have on their both social, economic, and physical health. Yeah. Nimesema zote. And then the last one, we have the personality disorders. So personality disorder is a bit difficult to explain. So you have what we call your personality. Everyone has a different personality, but there is a way that we have all accepted to behave. Despite our personalities might be different, there's a general way, there's a consensus in how people should behave in a society. So when you have individuals who deviate from this normal personality into a more maladaptive and a very rigid personality that differs from the normal. I'll give you an example. We have a personality disorder called histrionic personality disorder. It's very common. It's where a patient is very egocentric, is very emotional, tends to think that the world revolves around them. Yeah, and it's a bit difficult to diagnose. Yeah, tumemaliza.
Yes.
Yeah.
Now, thank you. Let's get to, let me pick depression, because that's the most common. Yes. Depression, and that is what we see with so many people like now, maybe in our places of work, in our homes. And they normally say layman language. We say umefikiria sana, maybe ako na mawazo mengi. Is it that?
Okay, so what is depression?
Yes, what is depression?
And what causes
nini hiyo kufikiria ndio
depression?
inaleta this depression?
Yes, and when is being depressed classified as a disorder?
Depression, exactly.
Yeah. I will say this even together, because anxiety and depression ni kama
same, naendana pamoja.
Kama ugali na sukuma.
Yes.
Being anxious and being depressed, these are normal emotions that we go through in life. Not all forms. For example, if you lost someone and you're exhibiting symptoms of depression, I'm not going to say that, oh yeah, you're mentally ill. No. There's a certain criteria that depression has to fit before it's considered as a mental illness, before you're told, go and see Dr. Tarus. Okay, so let's talk about depression.
Yes.
So depression is a form of a mood disorder where you have a patient who has persistently low moods despite positive stimuli around them. Right? Like I cannot walk into a funeral and diagnose people with depression. There's a certain criteria that you can know whether you have depression that is pathological in nature. And most common symptoms of depressions are changing in your sleeping habits. You find a patient who is either not able to sleep or is sleeping a lot. And then you have changes in your eating habits, a patient eating a lot or not eating too much.
Yes.
Then you have what is called social withdrawal, like not wanting to be together with other people. Because human beings are social creatures.
They seclude themselves.
Secluding themselves. Then we have something called anhedonia. Anhedonia means that, Caroline, you're no longer interested in the things that you used to be interested in. For example, you have a son, he used to enjoy playing football. He loved it so much, and then all of a sudden he doesn't want to go and play football. It no longer brings the same joy Yes. So these are some of the classic examples of clinical symptoms of depression. Now, here's the catch.
Yes.
These symptoms have to be persistent for at least 2 weeks for us to say that Carol might be suffering from depression. Now, what causes depression? It's a mixture of both environmental and genetic factors. Stress is a risk factor for developing
Depression.
Yes. So what causes depression at a chemical level is that we have these chemicals called the dopamine and serotonin that are produced by the cells in your nervous system when you do certain things, right? So people with depression are known to have low levels of these chemicals. Yeah. So these chemicals make you feel good, make you feel relaxed, make you feel like you want to socialize, make you feel contentment and fulfillment in life. Yes. So depression is not just a label, but it's actually a disease with a pathophysiology. Like we can actually look into a microscope and say that so-and-so is suffering from depression. Yeah.
Is depression more or less the same as bipolar?
Bipolar
Yes.
is also another type of mood disorder,
Yes.
right? So we have 2 states of your mood. You can be depressed when your mood is down,
Yes.
and then you can be normal, we call the normal mood, we call it euthymic, and then it can be
Hyper.
when it's hyper, we call it mania, right? So bipolar comes from the 2 words bi, which means 2, like bipartisan in Amanisha.
True.
Yeah.
Yes.
And then polar means poles, like ends, like North Pole and South Pole. So people who have bipolar, you'll find their mood fluctuating from a depressed mood to normal to what we call the manic mood. So what is the opposite of depression? It's called mania. Mania is a state that is just as dangerous, if not even more dangerous than depression. A patient who has mania will have excessive, this is bipolar disorder, will have excessive levels of energy. They'll start talking too much, laughing, thinking a lot, walking around. They might even harm themselves or harm people around them. They will have like, they want to do something and no one can stop them from fulfilling that specific task. Yeah. So that's what you find. So people in bipolar, you'll find at one point they're depressed and at risk of committing suicide. And then at the other end, they'll be manic and they'll be walking around shouting and screaming. And that's when they usually get admitted to hospital. Yeah.
And then there are these people who just go mute. Just, there's no showing emotions, nothing. Just.
Or you're describing a state that we call catatonia. You see that in patients who have schizophrenia. So when a patient has catatonia, that could be a symptom that they're suffering from schizophrenia. When a patient has catatonia, they don't want to talk. They don't want to move around. Sometimes they don't even want to eat or speak or show any emotions. Of course, that falls under different types of mental illness. We call them now the psychotic illnesses.
You mentioned about questioning like parents sometimes or relatives. Does it mean that it's genetic?
Yeah, most mental illnesses
Yes.
have a component of genetics behind them. In fact, scientists have been able to seclude some genes that leave people susceptible to like anxiety disorders. But again, I would caution you to tell you this. It's just like the way high blood pressure and diabetes are genetic, but not entirely genetic. There's also like environmental factors that come into interplay. But diseases like schizophrenia and bipolar mood disorder, even more than depression, have been seen to be very genetic. Okay? I'll give you an example. So with schizophrenia, if I have schizophrenia, the chances that a close family member of mine can also depend on it, I'm talking a direct family member can also develop it, is about it's about 15%. If I have an identical twin, there's 45% chance that they might actually develop schizophrenia. So there's some element of
genetic.
Yes. And I mean, we are broadcasting also to the grassroots of Kenya, right?
Yes.
To the
Yes.
innermost, the
Yeah.
mashinani kabisa.
Yes.
Sindio?
Yes.
You find that there's usually this perception that hii familia fulani imerogwa.
Nasema mtoto wake
Babu
wa kwanza
alikuwa na shida, baba ako na shida, kijana wake pia ako na shida, mjukuu pia ako na shida. Hiyo ni laana. Most of the cases it's not. It's usually probably an undiagnosed mental illness that has been inherited by the next generation, and due to the lack of education, the lack of proper treatment, you have you have the propagation without any.
You're right.
Yeah.
Thank you. Let's take a break. We'll come back. Nyoru kamunget kitigin asigeweke ngalale akobo kaimutiet anan kaimutik chebo kabwatutik ole kimitei ak Daktari Hilary Tarus.